Okay, we will now advance 3 weeks to the fourth and final meeting of the Pandemic Emergency Board on December 18th, 2019.
Okay, thank you for reconvening, and let's get an update from Dr. Rivers.
In the last 3 weeks, case numbers have continued to grow exponentially. We now have an estimated 4.2 million cases and 240,000 deaths. Almost every country is now reporting cases, and those who aren't may simply not have the resources to conduct surveillance. We don't see any change in the rate of rapid spread, and models estimate that we could have more than 12 million cases and close to 1 million deaths by mid-January. We're not sure how big this could get, but there's no end in sight. Financial markets are universally down by 15% or more on the year. Fear of a catastrophic pandemic and uncertainty about the capacity for governments to respond and remain viable are fueling investor uncertainty.
We have called this meeting today because of major strategic problems around communication that are happening globally. And here's a media debate that just happened on air today.
Alarming news emerging from social media companies today about the CAPS pandemic. Twitter and Facebook are reporting they've identified and deleted a disturbing number of accounts dedicated to spreading disinformation about the outbreak. For more on this, we go to our correspondent, Catalina Parks.
Chen, these accounts were created by several state-sponsored groups intending to sow political discord, and some individuals are seemingly seeking to gain financial advantages. Violence against healthcare workers and minority populations has been increasing. A recent riot highlights the real danger in these posts. Countries are reacting in different ways as to how best to manage the overwhelming amounts of dis and misinformation circulating over the internet. In some cases, limited internet shutdowns are being implemented to quell panic.
Thank you, Catalina. For more on this, we are joined by experts on crisis communications and social media, Kevin McAleese and Sarah Lee.
To me, it is clear countries need to make strong efforts to manage both mis- and disinformation. We know social media companies are working around the clock to combat these disinformation campaigns. The task of identifying every bad actor is immense. And experts agree that new disinformation campaigns are being generated every day. This is a huge problem that's going to keep us from ending the pandemic and might even lead to the fall of governments, as we saw in the Arab Spring. If the solution means controlling and reducing access to information, I think it's the right choice.
I agree with Kevin. This is a big problem and doesn't even account for the massive amounts of misinformation being generated by legitimate users about the pandemic. But it's not just trolls who are spreading the fake news. It's often political leaders themselves. Who's to judge what's real or not? Would we trust every government to separate truth from lies?
I think this is more than just keeping the bad information out. It's also about making sure real public health information reaches the public. News is found from outlets other than social media. News organisations, public health groups and companies need to help people take the right actions to protect themselves by promoting accurate, real information about the outbreak.
Okay, for more on this, we're going to get a briefing from our communications expert, Dr. Sell.
Global health experts have highlighted that dis and misinformation are wreaking havoc on the CAPS response. Health workers are under attack in a number of locations due to rumors that they are purposely spreading the disease. And response efforts in many places have had to be suspended because of concerns around violence. Pharmaceutical companies are being accused of introducing the CAPS virus so they can make money on drugs and vaccines, and have seen public faith in their products plummet. Unrest due to false rumors and divisive messaging is rising and is exacerbating spread of the disease as levels of trust fall and people stop cooperating with response efforts. This is a massive problem, one that threatens governments and trusted institutions. Polls have shown that mis- and disinformation are ubiquitous. At least 90% of the public has been exposed to these messages. At the same time, misinformation messages come from a variety of sources, even government officials. And often governments are contradicting one another. We know that social media is now the primary way that many people get their news. So interruptions to these platforms could curb the spread of misinformation, but could also limit access to information from legitimate sources. health ministries around the world are attempting to combat mis- and disinformation by amplifying public health messaging through social and traditional media. But they are being outpaced by false and misleading information. National governments are considering or have already implemented a range of interventions to combat misinformation. Some governments have taken control of national access to the internet. Others are censoring websites and social media content. And a small number have shut down internet access completely to prevent the spread of misinformation. Penalties have been put in place for spreading harmful falsehoods, including arrests. Other countries have taken a more moderate approach and have focused on promoting fact-checking efforts and working with traditional media outlets, yet these approaches are limited in scope. Social media companies report that they're doing all they can to limit the use of their platforms for nefarious or misleading purposes. But this is a technically difficult problem, and false, misleading, or half-true information is difficult to sort without limiting potentially true messages. The bottom line is that members of the public no longer know who to trust. Both the misinformation and the measures to control it have led to a crisis of confidence.
Thank you, Dr. Sell. So here's the policy crisis for this meeting of the board. How can governments, international businesses, international organizations ensure that reliable information is getting to the public and prevent highly damaging and false information to the extent that's possible about the pandemic from spreading and causing deepening crisis around the world? How much control of information should there be, and by whom? And how can false information be effectively challenged? And what if that false information is coming from companies or from governments? So, your views would welcome.
So I would start by where trust exists in the ecosystem. Jane, in a prior meeting, mentioned that there's considerable trust by employees of their employer, and that's been borne out by our own trust barometer in the last several years, where it's extraordinary the amount of trust given to the employer. And coupled with that, in times of crisis, as we're living, the role of the CEO and the trust given to the CEO for advocacy and for advancement of accurate information is considerable. I would marry the business leadership of the employer with business leadership organizations, such as the BRT and like enterprises around the globe. But I also think we're at a moment where the social media platforms have to step forward and recognize the moment to assert that they're a technology platform and not a broadcaster is over. They, in fact, have to be a participant in broadcasting accurate information and partnering with the scientific and health communities to counterweight, if not flood the zone, of accurate information, because to put the genie back in the bottle of the misinformation and disinformation is nigh impossible.
So flood good information. Okay, others, yeah, Jane?
Yeah, so can I agree with that? And my fact, it did come from the Edelman Trust Index, you'll be pleased to know, but also borne out by the work I've done as a CEO in my time. Can I also add that I think there are real technology opportunities here. I personally do not believe that trying to shut things down in terms of information is either practical or desirable. And we do have, I think, a couple of strategies that are available to us, one of which is the flood strategy, second of which is relying and informing and equipping trusted sources of information with the facts so they can then pass that on. But we also need to actually think about a technological answer to this. So there is work that's being done to actually create algorithms to sift through information on these kind of social media platforms. And I know that the Gates Foundation and others are funding organisations to work on things like this in order that people can actually have more confidence in the sources that they will use in any event. So I think both a detailed solution working with individuals, but then also thinking about technology is something we have to advance.
Asti.
So looping back into the trust barometer, last year in Davos it was released that trust in traditional media sources has grown, while trust in social media sources has gone down, specifically after the last elections in the United States. So I think one of the ways that we need to approach this is to make sure that we have the right representatives on traditional media networks in order to portray our side of the story and make sure that there isn't misinformation. I agree with Jane that shutting down internet is only going to cause extra panic and extra anxiety. In fact, that staff tells me places where internet access has been shut down, there's unrest growing. So we're not only dealing with this specific situation, but really people not trusting their governments at this point. And so I think we really need to make sure, one, from a news perspective, that information is being disseminated correctly and that we have the right resources out there to provide this information. I also think that there is a good point in trusting in employees, in your employers. There are lots of communications channel. For example, during the Ebola crisis at Texas Children's Hospital, we had daily briefings with the CDC to tell us what the situation was. And because of those daily briefings, we used between the intranet, internal global communications, and town halls, we use those sources to be able to disseminate information and make sure that our employees knew exactly what was going on, coming straight from the source, whether it was from our CEO, our chief nursing officer, or others within the hospital.
Okay, Tim and Chris? Oh, sorry.
No, I think a complementary tactic, too, is to tap faith-based organizations and civil society and other institutions to recruit them also to basically, almost at a grassroots level, continue to basically have the integrity of the information.
So I just pick up on the daily briefings or twice daily briefings. During H1N1, WHO filled the parking lot in Geneva with the global press and provided them daily updates on what was happening. And I think that's a manifestation of flood, meaning you have to lead and lead regularly. And I think in the terms of the content is what we know and point to where communications have actually been pretty good. I think we projected the exponential increase in this quite well, and therefore there's legitimacy to what's being communicated. And so be clear about what's being communicated that we know and that is right, but also be very clear about communicating what is absolutely wrong. And being clear about that, and then also being clear about uncertainty and that's being managed. So I think in those three domains, it's very important not to deny, but to speak to them very clearly in the context of a daily briefing from, in this case, I can't imagine any other institution than WHO being the focal point.
Martin and Chris, and then I'll come down this line.
Thank you. I fully agree that this is pure crisis communication, and crisis communication today, also social media is part of it. And just to limit or even stop social media would create a huge damage. And we should use it, we should get it on our side, we should work together with them, and we should try to avoid this misinformation. And another topic is, I mean, our industry, there are indications, meanwhile, that we are getting this social conspiracy theory topic, that we are part of this conspiracy theory, that we are supporting this, that wealthy countries will spread out caps to poorer countries. And this is a clearly thing of social media that could be directed via clear crisis communication and confirmed and regular updated information. So I also agree with Matthew, companies this responsibility that the CEO talks to the staff, that the CEO improves this information flow, and then we have a chance to get it channeled.
So in this case, do you think governments are at the point where they need to require social media companies to operate in a certain way? I hear you saying social media companies should not be impaired. Yep. But do they need to operate under different conditions? I think Matt alluded to that as well.
Yes, I would say there are specific conditions now, and we have to find a way to cooperate and we have to find solutions for this, but not to hamper them.
Chris?
So I just want to build on Ed's comment about the importance of civil society and faith-based communities. I think, in addition to employers, people trust their neighbors, trust their local community organizations. With 3 million cases in the Americas, you know that local communities around the countries have been responding, whether it's to manage daycare so people can stay in school or go to work. So while the social media can provide better quality information, I think actually local community organizations can help individuals understand how to filter out some of the noise and to act on the good information that's there. I think it's an important lesson that we've learned recently. We're learning as we speak in East Africa with the Ebola outbreak. If you don't have the community trust and engagement, you can't deliver even effective countermeasures, even when you have them. So I think the importance of local community, perhaps married to and as a filter for helping to discern the truth from the misinformation on the technology platforms, is going to be an important part of this response.
Steve, Brad, and then we'll go down the table here.
Just 2 points. First is that we have to recognize that we are all susceptible to misinformation based on our prior beliefs and experience. And I think with the social media platforms, there's an opportunity to understand who it is that's susceptible in what form to misinformation. So I think there's an opportunity to collect data from that communication mechanism. The second thing is, with that ability, we can identify false information more quickly. We are actually receiving reports about people trying treatments that are purported to be effective but are actually harmful. And the quicker that's recognized and can be countered, the fewer people will fall susceptible to those things.
Okay, thanks, Brad.
Yeah, I don't want to be repetitive. I agree with almost everything that was said, but when we talk about our health, who do we typically trust? Our physician. And we're not talking about that right now. So, I mean, we need the physicians and the medical community really out there on the forefront talking about this. I remember I had access to local news in Atlanta when the patient was taken care of for Ebola that came back, and physicians were on there nightly talking about, you know, don't panic, it's okay, this isn't going to go spread. So I would add physicians to it.
Okay. Yeah.
Got some important news to share from our member companies. Rumors are actually spreading that the antivirals are causing CAPS, and so patients are not taking them anymore. And this is particularly an area where we have government mistrust. On the other hand, it's interesting because we are doing clinical trials in new antiretrovirals and, in fact, in vaccines. And social media, including Facebook, is actually enhancing recruitment. People are going to it, and they're actually seeking information on where they can participate and sign up. And so I sort of wonder that maybe we're in the mistake of reporting and counting all the fatalities and infections, and we're not sharing with people what are the wins. You know, who are the patient advocates that can say what worked for me, and maybe you should try that. I think we have an opportunity here.
Okay, George, and then Avril.
Oh, sorry, you go ahead.
No.
You know, by now, you know, we have more cases in China and also death cases reported, and also my staff told me that before there's misinformation and there's some belief. People believe, you know, this is a man-made, some pharmaceutical company made the virus. So there are some violations and even, you know, death is because of this misinformation. As a, you know, from like the CDC, and I don't know whether Steve agree with me, when you are doing the field work and you like to do some so-called TOT, training of trainers. So we really need to train the health workers, especially health care workers, their access to the patients, to the public. So make sure they got the right information. So not necessarily, you know, sometimes the health care workers, they know something, but if they are not well trained, they might give the wrong information, but also they might say something, oh, I don't know. You know, even I don't know, that could hurt. So when I remember that's such a situation reminded me. When I was in Sierra Leone, and I was interviewed by radio, the national radio, I was asked by one of the audience to say, okay, we believe Ebola was man-made. It's transported from, you know, somewhere. So this is, I think this is very important. We do the TOT. So make sure the healthcare workers have the right information.
Okay, thank you.